Hi, welcome to the Spine MDT. This video is about how to maintain a healthy spine. Maintenance is the fifth and final step of my 5-step fast track to a better back, and it's probably the most important step. Click the link below to download my free guide and find out more about the one-stop clinic and the fast track process. So the reason why I say maintenance is probably the most important step is because whatever treatment you may have had for your back pain or any spine disease is not a permanent cure, whether that's treatment from a physiotherapist, an osteopath or a chiropractor, or even if you've had surgery, it treats with the problem that you have at that time. But there's an underlying condition, there's an underlying reason why you developed back pain or neck pain or spine disease in the first place, and that's why you have to try and maintain a healthy spine to try and prevent a recurrence. And this is quite a common problem. I often see patients who say to me, I've been to my chiropractor for 10 years now, and quite often he just puts me back together, does a manipulation, cracks my back, I feel better and I go off again, but now it's been happening more frequently. Or I've seen patients who've had surgery before to their spine, they've got better, but they've come back with a recurrent problem a year or two later. That's because these treatments often give you a temporary result that make you feel better for a bit, but you're not really helping the underlying condition. You're not maintaining a strong core to protect your spine. And that's the whole philosophy of the Spine MDT. Finding the least invasive solution that gives you the longest lasting result means that there's no point having repeated treatments that aren't giving you the definitive longer lasting result. So once you've got over the acute problem of back pain or sciatica, and that could be with the treatment of one of the therapists or an operation, you then have to try and prevent that happening again. So how do we do that? Well, the spine is made up of a stack of bones that are joined together by joints at the back, facet joints, ligaments and muscles and things. And you've got to maintain the health of all of those things. Like any other joint in the body, often the reason why it wears down and causes pain from arthritis or what we call degeneration, wear and tear, is because the muscles that surround and support that joint have weakened, and then we adapt bad habits and bad postures specifically. A lot of people I work with, office workers, and that's probably one of the biggest causes in terms of occupational causes. The spine through evolution has just not been designed, not been evolved yet for sitting down for long periods of time. Through human evolution, it's only in the last few thousand years that we started sitting in chairs. Prior to that, we roamed around, we were quite active, and then we just lay around. We didn't form chairs till quite later on. So the activities we do now that become quite common, sitting in chairs at offices, stooped over a laptop, much like I'm doing now for this video, are just not healthy for the spine. So the connection between posture and back pain and neck pain is a well recognized one. I wrote a blog about this a while ago. Click on the link below to find out more about this. But at your desk, having your workstation looked at carefully so the back is relatively straight, at the height of your seat is just right, so your thighs are relatively horizontal and your feet are well planted on the ground. Equally, the neck and the lower back are closely associated, so maintaining your screen level at the right height, again with the back straight and shoulders back, is very good. I strongly recommend standing desks, so you can alternate on the hour between sitting and standing, so that keeps the spine moving. And on the hour, have a little walk around just for a few seconds. Just get out of that whatever position you were in and move around. When you stand, shoulder widths apart, back relatively straight, and have the desk height just right so your forearms are easily resting on the desk. There is good evidence that it's not necessarily sitting and standing, it's being in one position for too long that is bad for your back. You can get your workstation looked at by your occupational therapist at work or occupational health department. So maintaining a strong core means keeping the muscles that support your spine, the muscles that run up and down your back, as well as your abdominal muscles and oblique muscles and the gluteal muscles, keeping them strong to support the spine. I did a blog about yoga and Pilates. They're excellent, both excellent for improving core strength. And there are different scenarios where one may be better for the other depending on your underlying condition. For improving mobility and flexibility, yoga tends to be better if that's the main issue. Or if there's some instability of your spine and you want to tighten up that core a bit more, then Pilates tends to be better. And there are different types of this. The reformer Pilates, shown here using these reformer machines, puts quite a fair bit of resistance against the muscles, and that's very helpful. But as mentioned before, the back and the spine is a dynamic structure of multiple bones with joints, so it likes to keep moving. Therefore, any form of exercise essentially is okay for the spine, is good for the spine. There are a few myths about running not being good because of impact on hard ground, wearing down the joints. Well, actually, overall, that's far better than sitting on the couch all day. It's better to move around, and actually, if you maintain the spine, if you condition the spine by keeping a strong core, it's fine to go out running. Weight loss or weight control is really important in maintaining a healthy spine. The less weight it has to bear that's excessive on the joints of the back of the spine and the discs, the less wear they can undergo. And there are two aspects to that. One is exercise, which we've talked about. That's really helpful in keeping your weight down. And the second aspect of that is the right diet. There are two aspects of diets. One is the weight control, as discussed, but also the nutrients you take in to maintain healthy bones, calcium, vitamin D, and things like that. With exercise, patients often ask me if they can lift weights, is it safe to do so? Well, actually, yes. If you work initially with a personal trainer who's just taught you the right form, then yes, absolutely, putting some resistance against the muscles to build them and strengthen the spine is really good, and that works for the whole body. People ask me about deadlifts and shoulder presses or back squats with barbell back squats. Again, if you use the right form, your spine should be healthy enough to do that. Make sure the weight that you load your spine with is the right amount, and that's where a personal trainer really comes in handy. We all know the harms of smoking for our general health, and that also includes for the spine. The spine wear and tear of the spine, degenerative disease, is well known to be a lot more so in smokers. So if you do smoke, that's a big step you can take to improve your spine health. Alcohol in moderation is absolutely fine, but an excess can lead to low density of your bones in your spine. As you get older, they can become more and more brittle. So okay to enjoy a few beers at the weekend, the odd glass of wine. Make sure you stay within the recommended range for men and women, but be careful about going into excess. And finally, sleeping. We're often told to lie in a very neutral position on our backs. Well, we're human. We all roll around in bed to try and get comfortable, so it's not always practical. Yes, lying on your back is healthy for the spine, but also there's good evidence lying on your side, particularly on your left side, is actually good. Is good for your sleep in general. So there's some good evidence that lying on your side improves the CSF, the fluid that your brain produces that literally washes your brain at night. You have better outflow of that fluid and production of that fluid when you lie on your side. That in itself induces better sleep, which is generally better for back pain and spine health in the long term. So lying on your back or on your side is absolutely fine. It's lying on your front that isn't great because you have your head turned in a very acute angle, which puts a lot of strain on the neck muscles, and having problems with your neck can also affect your lower back. So to summarise, try and avoid a lot of the habits I see with patients. They have a bout of acute back pain, it gets treated, it goes away, and they think I don't need to do anything anymore. Well, actually, that's the most important time to engage in proactively maintaining a healthy spine with exercise, good diet, good sleep, and really importantly, maintaining a healthy posture during work. So I hope you found this video helpful. If you did, press the like button, also the subscribe button so you keep up to date with future videos I post. I post a video weekly on back and spine health, which I hope you find useful. The goal of the Spine MDT is to find the least invasive solution that gives you the longest lasting result, and that's by bringing all the professions of spine care, osteopathy, chiropractic, physiotherapy, spine surgery, pain specialists, all in one organisation working together to deliver that result. Please visit our website, email us or call us, and hopefully we can help you.